Hello, my name is Ashely Williamson. I'm a student at Tcat Nashville. Today's date is August the 21st. The time is 6:40 p.m. Here's my badge. Today I'll be talking about three skills. Collecting the sputum will be the first. Upon entering the room, you'll want to wash your hands and explain the procedure to the patient. You'll need to carry a sterile cup for your collection. You'll need to instruct the patient that your collection of sputum needs to come directly from the lungs. So upon taking 3 deep breaths, they need to cough, and you'll need to place that sputum in the cup, replace the top, make sure the top does not contaminate. You'll need to wash your hands and send this sputum directly to the lab. The next skill I'll talk about will be collecting stool. So upon entering the room, you'll need to wash your hands. You'll need to provide privacy, explain the procedure to the patient, and you'll need to carry along with you a sterile cup for your stool. You'll also need to take a hat, which that will be the collecting device, and you'll need to instruct the patient to um, go to the restroom, and when they're providing the stool, they don't need to uh, put any tissue in the hat because it could contaminate the results. It's okay to use the tissue, but they need to put it in the toilet or either in the trash can. After they have collected the stool, you'll need to immediately go and collect the you'll need to collect your specimen, and you need to use a clean spoon or a tongue depressor. You'll collect stool from their collection that they provide for you. Put it in a sterile cup. You can use the spoon or the tongue depressor to actually get your stool. After you have sent your specimen off to the lab, you'll need to chart your color, you'll need to chart the consistency, and you'll need to report any blood finding in the stool. Also, if it's for an ovarian parasite, you'll need to send that directly to the lab. The next skill is going to be collecting a clean catch. Upon entering the room, you'll need to wash your hands, you'll need to provide privacy, and you'll need to explain your procedure to the patient. You need to take a hat, which will be for the measuring of the urine, and you'll need to take a sterile cup, which this is where you're going to place your urine in order to send to the lab. So upon asking the patient to go to the restroom, you'll need to instruct them, again, not to put any tissue in the hat with the urine, and also they need to cleanse their perineal area first before collecting any of the urine. First, you'll want them to cleanse. Then you'll ask them to urinate, and as the flow is going toward the middle of the flow, they'll need to collect the urine in the specimen cup, and then close the top on the cup, and then the rest of the urine will go into the toilet. And you'll need to report any abnormal findings, and you'll need to send this specimen directly to the lab.